Good morning, Rotarians and friends, on this lovely Sunday morning. On behalf of Rotary Club of Bombay Sea Coast and Innerwheel Club of Bombay Sea Coast President Nita Mirchandani, I welcome you all for our second webinar on medical projects, Heart Attack, W.A.R. Warning Signs, Actions, Recovery. Friends, I also welcome all our district dignitaries and Innerwheel dignitaries who have joined us today for this webinar. I am grateful to 15 co-host clubs who are also with us today. Let me express our gratitude to them. Bombay Northwest Malad President Raju Patel, Mumbai Kandivali West President Rajendra Bhatia, Mumbai VKC President Uday Niyogi, Bombay North Island President Danish Dhamija, RC Dahisar President Ranjit Bijur, Mumbai Harmony President Anand Tagarse, Mumbai West End President Pankaj Ria, Mumbai Parleshwar President Jyoti Bablali, Mumbai Khar President Vijay Raghavan, Mumbai Jewel President Ekta Agrawal, Mumbai Warsaw President Kalpana Jain, Bombay West President Dr. Manoj Patel, RCM Iconic President Chittaranjan Gupta, RCM Juhu President Kalash Sridhar, RCM Juhu Beach President Smita Shah. We are all thankful to you for co-hosting this important event. Heart Attack W.A.R. Warning Signs, Action, Recovery. Friends, how often we hear sudden loss of our near and dear ones due to heart attack. And then we start thinking, could it have been prevented? When heart attack came, was action taken properly? Whether he could have recovered? And now in this COVID era, I hear a lot of my friends saying that are we prone to heart attack more now in this COVID era? To answer all our questions, we have invited our own eminent physician and interventional cardiologist, our past president, who for last several years pioneered projects for AED and CPR training, our own Dr. Surendra Soneji. Now I request our medical director, Rotarian Kunal Kapadia, to moderate the session. Kunal.
Thank you, President Kishore. Hello, everyone. Thank you so much for taking time out on a lazy Sunday. It's going to be a heartwarming day. My name is Kunal Kapadia, and I'm the MD of Rotary Club of Bombay Sea Coast. No, the MD is the guy who just spoke, President Kishore Masurkar. Neither am I a doctor nor a managing director. In my case, MD stands for Medical Director of Rotary Club of Bombay Sea Coast. In fact, I'm a simple commerce graduate with a so-called MBA. Before I go on my verbal diarrhea, I would like to thank my dear Sea Coasters, my president, and my team medical, comprising of 14 Sea Coasters, for all their help. Enough said about me. It's time to introduce the man himself. I call him the Mercedes SLS of our club. I absolutely love that car and its design. So here's Dr. Surendra L. Soneji, SLS, a man who has completed his Inter-Science First Class First with gold medal in chemistry. He has many firsts to his name, including standing first as MD Medicine with a gold medal, stood first in MD Cardiology, being the first qualified cardiologist of Bombay University, ex-emeritus professor of cardiology at Nair Hospital, practicing for 47 long years with diagnostic and therapeutic skills second to none in Mumbai. He's attached to various hospitals, including Hinduja Khar. He's done 6 Save Your Heart seminars in Rotary over the last 30 years. Society for Heart Failure and Heart Transplant awarded him a Lifetime Achievement Award at the hands of Anant Goenka, who is the owner of RPG Group. Let's see a short video on the man himself.
Dr. S. Soneji, the first DM cardiologist from Mumbai and well known for his clinical acumen. His Save Your Heart organization educated more than 4,000 Rotarians on how to prevent heart attack and train them in CPR. He has now embarked on training the lay public in CPR and use of automatic external defibrillator. His endeavors have borne fruit, and 12 AEDs have been placed at police stations in Western Mumbai and various public places. His enthusiasm belies his age. Dr. S. Soneji, the first DM cardiologist from Mumbai and well known for his clinical acumen. His Save Your Heart organization.
Sorry about that technical glitch. Okay, so can we have the first slide, please, Beslin, Rahul? Just the title slide. Okay, just keep it on this, please.
Full screen there. That's
Yeah.
it.
So here's the way forward in the limited time we have to make you almost doctors. That is, give you a simplified playbook to deal with such situations. We will have a few slides that Doc will speak on. This will take about 57 minutes, and we will reserve 3 minutes for Q&A. I'm just kidding. Doctor will take us through the basics for about 25 minutes, and the remaining time will be for Q&A. So do post your questions in the chat box. And if you write good things about me, I will pick and ask your questions. All of us are wearing a jacket today on a Sunday sitting at home. That is the circle of influence that our beloved doctor has on all of us. When he talks, we listen. So guys, please do listen. Now to the serious part. The core theme is action, timely action. Doctor, how does one know that he or she is getting a heart attack? What are the signs?
Okay, I think that we will, let me first say what I want to say and then we'll show you the slides after that, okay? At the outset, let me thank our dynamic President Kishore Masurkar and flamboyant Medical Director Kunal Kapadia for asking me to talk about a subject that is so close to my heart attack. I can keep speaking till cows come home, but I will try to keep it short. At the outset, let me say that I feel guilty. I confess guilt. One, supplying Kunal with my biodata, and two, immensely enjoying the exaggerated version that he gave of my biodata. Friends, with these few words, I would first say that heart. No, can you put my thing instead of Kunal's on the right-hand corner, Veslin? Yes, that's better. Heart is a fist-sized structure situated behind the breastbone slightly towards the left. Heart is a pump. It pumps oxygenated blood to brain and all the organs in the body and deoxygenated blood to the lungs for oxygenation. Every pump needs energy, and the energy is supplied by the nutrients in the blood. Now, heart has 4 cavities. Everybody knows: left ventricle, right atrium, left atrium, full of blood. Unfortunately, the heart cannot derive nutrition from the blood that is present within its cavities. It is like a poet who is drowning in the sea. He says, water, water everywhere, not a drop of water to drink. So, heart is supplied with nutrients by 2 coronary arteries, the left coronary artery and the right coronary artery. And God has given us such tremendous amount of reserve that unless we misbehave and narrow these arteries to 70% or more, generally symptoms do not occur. Occasionally, a 30-40% plaque may rupture and produce a heart attack, but usually more than 70% narrowing is required to produce symptoms. Can we have the next slide, please? Okay, now these are the symptoms of angina or heart attack. What is the word angina? When a person walks or climbs, he gets chest pain in the center of the chest, as you see in the first slide, or any of the variants which I'll tell you. And when he stops, the pain stops. That is known as angina. If the pain or discomfort persists for more than half an hour, then the person is heading for heart attack. In the first picture, you see a person gripping his chest. That is because he's getting severe retrosternal chest pain, which may go to the jaws, it may go to left hand, it may go to right hand, it may go to back, it may go to the stomach. Or some people may just feel dizzy. They have profuse sweating and immense feeling that they are going to collapse. Now, women, incidentally, are more likely to have variants of angina than the classical angina. At times, a person goes to a doctor for a routine check, pre-employment or whatever it is, and a cardiogram is taken and shows heart attack. So when he's asked, did you have chest pain? He said, I never had chest pain. How does that happen? This is more common in diabetics because the nerves supplying the heart area are paralyzed. So silent attacks can occur in these people. Next slide, please.
So, doctor, I wanted to check with you, why does speed matter and what is the golden hour? Can you explain to the audience, please?
Yes, Kunal. Now, if you see this slide, it shows that 80% of all the deaths that are going to occur in myocardial infarction are going to occur within the first 24 hours. So first 24 hours are very critical. Out of this, within the first hour, whether you are in the hospital or you are at home, half to 2/3 of the deaths have already occurred. That is why we say that you should act fast, report fast, and if you report within this golden hour, we are able to not only save your life, but we can save your muscle and even prevent heart attack.
Excellent. Thanks, doc. And doctor, what action can you take immediately upon having a situation where you think you've got something like this, a heart condition?
Okay. Next slide, please. Friends, there are certain medicines which I carry, and I expect all my patients who are likely to have heart trouble in the family or elderly in a small pouch like this. What should a person carry? This is a tablet of soluble aspirin, not entry-coated aspirin, 325 milligrams. This is a tablet of clopidogrel. It's a blood thinner. Aspirin and clopidogrel are both blood thinners. You should swallow 8 tablets of clopidogrel and 1 tablet of aspirin immediately. If you are already on blood thinners, then 4 tablets of clopidogrel are enough. Atorvastatin, that is a statin, which is to be swallowed 80 milligrams, 1 shot. And for pain relief, there is a tablet which is there in this small little bottle, which is known as glyceryl trinitrate. It's an ultra fast acting 0.5 milligram glyceryl trinitrate. You keep under the tongue, sit down. Don't try to stand because the blood pressure may drop and you may feel giddy. Also, nowadays, because of COVID, everybody has a pulse oximeter at home. Put on the pulse oximeter. If you put on the pulse oximeter, you should see that the saturation of oxygen in the peripheral blood should be more than 90%. If it is less than 90%, administering oxygen is helpful. If it is more than 90% and you administer oxygen, you may actually do harm to the patient. So it is better that you have a pulse oximeter. Keep a packet which has aspirin, clopidogrel, and atorvastatin, and ultra fast acting glyceryl trinitrate with you. I hope I answered your question, Kunal.
Yes, thank you, doctor. Doctor, can you give us an example? You must have seen so many cases. We spoke about quick action. Do you have an example to show that quick action can really, really make a difference?
Yeah, can I have the next slide, please? Okay, so those of you who are doctors or those who are familiar with the ECG a little bit, this is a 77-year-old person who is my personal dear friend for last 64 years. I have not gone to any hospital at all. When he says that he's having profuse sweating, he cannot stand, and a sensation of passing stool, his wife rings me up. I was in my half pants taking my morning walk on 11th of last month. I told him, rush to Hinduja hospital. The ECG taken shows ST elevation in 2, 3 and AVF and V3, V4, V5, V6. That means it is an extensive inferolateral infarct with reciprocal depressions in V1 and AVL. I almost collapsed. I rushed to the hospital straight away in my half pant to the casualty. Luckily, we had thrombolytic drugs available. We injected. And in half an hour's time, the ECG that is taken is seen on the right side. it is completely 100% normal. Any cardiologist will tell you this is a totally normal ECG. Now, what has happened? Because he has heard our lectures, because he is aware that something can go wrong, he reported to the hospital immediately, and within 1 hour, we administered the drug. In 1.5 hours' time, his clot is dissolved. The new formation of clot is dissolved. That doesn't mean that the basic disease has disappeared. A flow has been established, a heart attack has been avoided. But now it's a custom that they take him to do a CT scan to rule out COVID, do a throat swab, and Monday morning, this was Saturday, Monday morning we did the angiogram. Can I have a next slide, please? Next slide, please. Yes. Here on the left side, you can see the right coronary artery. As I told you, we have two coronary arteries, the left artery and the right artery. The left artery was almost normal with minimal blocks. So we did nothing to that. But the right coronary artery shows multiple lesions just below the diaphragm, extending for about 30 millimeters or so, the maximum being almost 99%. Now we have established the flow, we have prevented a heart attack, and on the right side, you see that we have done a balloon angioplasty and put a stent there, and the flow is established like a Tansa pipe. This man has recovered. He goes up and down one flight of stairs, walks 5,000 steps, and keeps on singing for his supper so that his wife can give him some food. Friends, if you report early, we can not only save your life, but we can save muscle. Time is muscle. The longer you wait, more and more muscle will be damaged. How do you know that we have saved his muscle? I did his echocardiogram. 2D echocardiogram shows if there's any regional wall motion abnormality where the blood flow was reduced. In his case, his echocardiogram is 100% normal, saying that the muscle which was under threat has now been saved. The flow has been established. Now, taking medications and regular exercise and the correct food, I think events should not occur in future.
Right. Thank you so much, Doctor. Speed does matter.
Yes.
Doc, on a separate note, we read about an executive that collapsed after his run. It was all over WhatsApp and in the newspapers. He died. He was a fit guy, worked out regularly, ate carefully, and yet this happened. It's unfortunate and it's happened before. What could the family have done when he collapsed in his house after his run?
Okay. So the thing is like this, Kunal. There are various reasons how a person can certainly collapse. One is coronary artery disease. I have a very dear friend of mine. He's a gynecologist. I don't want to name him. He was a regular jogger. He was going on Pali Hill for a jog. Suddenly he got fit. He came to our Rotary to speak also. Suddenly he collapsed and he died. Now this is obviously coronary artery disease. Whereas sometimes there's an entity known as prolonged QT interval, which some of our Rotarians also have. Those are the people who are prone to arrhythmias or irregularity of the heartbeats, and they may not be having heart attacks. But ultimate result is same. The heart stops or you go into ventricular fibrillation. If your heart stops or you go into ventricular fibrillation, what can be done is known as CPR. Everybody in the country should be trained to do CPR. That is my passion. I would like to train as many people as possible, and as those who have been trained should train some more people of the correct technique of CPR. C is cardio, that means heart. P is pulmonary, that is lung, and R is resuscitation. Everybody should learn. As I told somebody that if I get a heart attack and I collapse, my knowledge of cardiology is totally useless. It's a bystander who can give me cardiac massage and save my life. So friends, what is the important thing? First is that the person should be removed from the mattress, which is foam mattress, onto the floor. Unless you put him on a hard back, your effort of pressing on the chest is not going to be very effective. Two, you see that there are no food particles in the mouth. You may be in a restaurant eating food or something. Don't ever put your finger in unconscious patient's mouth because he'll bite it off even if it's your wife or husband. Take a spoon, open the mouth, remove the food particles and the mouth closes tight again. Roll your handkerchief and put it in the person's mouth between the teeth so that the mouth remains open. And then keep the heel of your left hand in the center of the chest on the breastbone. Because when you give massage, you squeeze the heart between the breastbone and the backbone, and the circulation is established to all organs in the body. You place your right hand, you go to the right of the patient. You keep your left hand heel on the center of the chest and the fingers going on the left breast. The right hand fingers are intertwined in the left hand fingers, and you climb over the person. It is better because you'll require all the force to depress the sternum 3 to 5 centimeters, preferably 5 centimeters, to establish a good circulation. How many times a minute? 100 to 120 times a minute. It is not an easy job. You'll be exhausted in 5 minutes. Call a lot of people around who can take over from you. Somebody should rush to go and call an ambulance. Somebody should search where an AED is kept, because lots of AED has been kept by us, by a couple of other organizations. And if they are available, use the AED. Every exit of the airport has an AED. So you can use an AED to shock the person. We'll show you these in videos, how to perform these maneuvers. Can we have the first video of CPR? Next slide, please. Yeah. Here you see the correct technique or performance of CPR. The elbows are not to be bent. Your left hand on the chest, right hand on top of that. You climb on the fellow and you start giving massage. This is what is seen in the mannequin. Go ahead, play the video, please. No, not that one. Yes. No, this is the next video. Sorry for the clutch, he'll play it. Last time we played, it did play. Sorry for the delay. Actually, people will wonder when you press. Yes.
No problem. While he sorts the technicalities out,
I'll tell you what else I'll tell you. The thing is, when you press, somebody will ask, are you likely to fracture some bones? Please fracture some ribs. There's nothing wrong with that. But see that you give effective massage, because the fractured ribs are going to heal. Life will be saved if you keep on giving massage. They will ask you, how long should we continue? Until an ambulance and paramedics arrive, or until you finish 45 minutes to an hour. Keep trying, because patients have been revived. This has to be started within 3 to 5 minutes of the time that the patient collapses. If you spend more than 5 times in starting your cardiac massage, the person will survive, but he will have some brain damage. How do you know that it is a heart attack that has produced this unconsciousness? If it is simple syncope, you just give a painful stimulus anywhere above the eyebrow or on the chest or anywhere in the person will sit up. If the person doesn't sit up, you know that his heart has stopped and he's not breathing. Because of that, there'll be no breathing, and you start giving cardiac massage. Earlier, we used to give mouth-to-mouth respiration, but now it is no longer required. You just give cardiac massage, and if the massage is adequate, enough blood flow goes to the brain, kidneys, lungs, and all organs of the body. So doing and learning a technique of CPR is very, very, very important. I have a daughter in USA and I have a granddaughter. They are certified every 3 years that they know successfully how to give cardiac massage. and how to use an AED. That's how they can save some lives.
Understood. Thank you so much, doctor. So while we wait for the video or the technical glitch to get sorted out, can you give us a perspective on what is an AED machine?
Yes, I'll tell you.
Yes.
Now, earlier, this machine was not available. It is available for the last few years. In the hospitals, we use DC shock conversion machine known as a defibrillator on patient with a ventricular fibrillation or ventricular tachycardia where the person is not breathing. One pedal is kept below the right clavicle, and the other one is kept on the left side in the axilla by the side of the nipple, and a shock is delivered. When the shock is being delivered, nobody should touch the patient because he also might get a shock. So when you deliver a shock, this resets the rhythm and a normal sinus rhythm can start. If it is a standstill, that means if there is no complex scene on the ECG, then the patient needs to be paced. A pacemaker is inserted through a peripheral vein or a femoral vein into the heart, and the heart is paced. But if there is a ventricular fibrillation, the only way in the world you can convert ventricular fibrillation to sinus rhythm is by shocking. And this machine, AED, has been used. You can use it 5-6 times as they use at the airport, and the patient was transferred to Seven Hills and angiography done. He is alive and healthy. A guy was walking on promenade at Bandra and he collapsed. Somebody knew how to give cardiac massage. They knew there's one lying at the Otters Club. They got the machine, shocked him, and he went to Holy Family, and his angiography was done, plasty was done, and he's still alive. So we can save lives which were otherwise surely lost. As I told you, the only way to convert ventricular fibrillation to sinus rhythm is by giving a shock with this machine. So today we can buy these machines under CSR. Everybody should buy whatever money they can afford to spend and save more lives. Now, the AED is a machine that requires no charging, no maintenance, nothing. You just see that the light that is there is keep blinking. That means the machine is working. The battery is guaranteed for 4 years, and the machine is guaranteed for 5 years. However, 10 to 12 years, the machines have been used very successfully, and we have very good agents who look after them in case there are any problems. So far, I have been responsible for installing 12 machines. 10 have been through Rotary Club of Bombay Seacoast, one has been through Innerville Club, and one through the Borivali Club, Borivali East, which is kept at the Sanjay Gandhi National Park. Our very first machine was kept at the club Mahabaleshwar. So if you're at Mahabaleshwar and something goes wrong, you can always contact the club and they will be able to give you the machine to save a life. Police stations in our area, Santa Cruz, Villeparle, PKC, all have got machines kept with them, and the personnel have been trained how to use the machine. You will be surprised. A CPR was not being taught to commandos. You saw the picture, our video in which they have given me an award. So I personally trained the commandos at Bandra how to do CPR and how to use an AED, so they will be able to save some lives. I hope, Kunal, I've answered your questions.
Certainly, Doc. Just on a separate note, Beslin and Rahul, do we have the videos in place now? Or should we progress and then you will set it up a little later? Okay. Sorry? Excellent. Okay, fair enough. No problem.
Question answered,
so
yeah.
As soon as you connect it, please put it up. Okay, Doc. Now is the time for also simplicity. And while we wait for the videos, I just have a simple question.
Yes.
Why does one get a heart attack? And a follow-on is, Rotarian Ashok Chandavarkar's friend based out of London actually asked this question: what is a silent heart attack? Is there any way to catch it?
See, as I told you some time back, the very fact that it is silent, there's no way to catch it. When a person goes for pre-employment checkup, or he goes to a doctor and the doctor takes a routine ECG, you find telltale evidence. 100% there is, because there are Q waves, there is ST elevation, or ST now have become isoelectric, T wave inversions, and you know that this person genuinely had a heart attack. As it happened to one of our Rotarians, he came for our camp, and when the ECG was taken, it shows a heart attack. So he tells me, Suren, are you sure that I had a heart attack? I said, I'll stop practicing medicine if this is not a heart attack. He underwent angioplasty, is absolutely fit and fine and roaming about. So silent heart attacks are not known. Of course, that gentleman had chest pain, but silent heart attacks do occur in which patients do not have any discomfort. Routinely, they are discovered when they go for pre-op checkups or routine physical examination or routine checkups to various centers that are established now. As I told you, majority of them may be diabetics because diabetics have their nerves which are paralyzed because of painkillers are being destroyed, which pick up the pain from the heart, which is bad in a way, and they may have silent heart attacks.
Thank you, doctor. Doctor, two separate questions now. Are heart attacks genetic? And are men more likely to get an attack as compared to women? I know for sure that I might get one thanks to Purvi, but can you give a perspective on that?
Yes, I'll tell you. Now, there are several risk factors which are responsible for producing heart attack. There are certain risk factors which are not in our control. They are beyond our control, for which you can do nothing. One is you may be born in a family where there are premature heart attacks and deaths. So you have to take extra care of the other risk factors which should not be there, or if they are there, they should be controlled. So family history is a single very most important risk factor. Two, age. Advancing age will produce heart attacks as the age advances. As it is said, time and tide waits for no man, for that matter, not even a woman. So as the age advances, they are more likely to get heart attack. Three, women till menopause, because of the female hormones, are relatively protected from heart attack unless they smoke, take oral contraceptives, they got diabetes, they got blood pressure, they got worries, they got all sorts of things. Then they are likely to get heart attacks earlier. That does not mean that after menopause, giving HRT, which lots of people are giving, hormone replacement therapy, will prevent heart attack. Actually, the incidence of heart attack increases if you give HRT. So natural hormones are different from administering artificial hormones. Now, what are the other risk factors which are under our control? One is diabetes. One must control diabetes very well so that the vascular damage in the heart, in the brain, in the kidneys, in the peripheral limbs does not occur or is postponed as much as possible. Second is smoking. Smoking is totally under our control, 100%. You can stop smoking subtly, nothing happens. It is only a habit and not an addiction. You will not die. People tell me, doctor, I will not pass stool. I'll tell you, I'll give you medicines, you pass 6 stools. So smoking should be stopped completely and permanently. As Reader Digest says, it can affect every organ in the body adversely, including your sex. So what is the use of living without being able to perform well in bed? Thirdly, high blood pressure. High blood pressure, whatever the cause, whether it's hereditary, whether it is kidney disease or whatever it is, should be perfectly controlled. Once you maintain good control of blood pressure, you prevent heart attack from coming in. The fourth major risk factor is abnormal lipids. As you say, you dig your own teeth with you dig your own grave with your own teeth. If you keep on eating the wrong kind of fatty foods and fast foods and everything, and you are more prone to have high cholesterols and high triglycerides and all that, which can be today corrected by weight loss, by exercise, and by medications, then that can prevent heart attack. I hope I answered your question.
Certainly, Doc. Doc, I think we have our CPR video.
Good. Ready. Let's see.
So maybe we can just do a refresher.
Yep. Go on, Rahul, show the, that's it. You see, this is what it is. You have to put the full body force without bending your elbow, 100 to 120 times a minute, compressing the breastbone, which will compress the heart between the breastbone and the backbone and establish the circulation. The next video will show the next video. No, not this one. This one.
The next slide.
Yeah. This shows you the use of an AED. This is a speaking machine. It is used by common people, not by doctors. Doctors can also use it, but it speaks to you.
Begin by removing all clothing from the patient's chest. Look carefully at the pictures on the white adhesive pads. Peel or place pad exactly as shown in the picture. Press firmly to patient's bare skin.
This is a machine speaking.
Once that is in place, no one should touch the patient. Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 5 centimeters. Keep time with the beat.
So friends, you could see that Anil has shown us how to do CPR and how to use an AED on a mannequin. This can be used on a live person when a person collapses. Remove the clothes, connect the machine, start CPR and use it. You can give 5, 6 shocks, no problem. But as I said, start arranging for an ambulance, start looking for an AED, and shift the patient to a hospital, which is a catheter laboratory, and a doctor willing to come in the middle of the night or any time to come and open up the artery.
Thank you, Doc, for those valuable tips. Beslin, Rahul, can you please take off the presentation? Thank you. Right. Doc, there's an audience question that's come up.
Yes.
Is there an impact of COVID on heart health?
Yes. This is a very, very important thing. You will be surprised that even if the patient gets chest pain, he is not willing to go to the hospital, not only in India, but in USA and anywhere in the world, being afraid that if he goes to the hospital, he'll pick up COVID. So a lot of deaths are occurring at home. The home deaths have gone up. The hospital deaths due to heart attack have gone down. That is because, as I told you, the golden hour they are spending somewhere else and they are not able to come to the hospital, or they don't want to come to hospital. There are very, very few hospitals like Car Hinduja, which doesn't admit any COVID patient. All other hospitals in Bombay admit COVID patients, and patients are really scared to go to the hospital. Secondly, COVID, that is coronavirus itself, can affect all the 3 layers of the heart. There is a pericardium, which is outside the heart, which is a lubricant, which allows the heart to pump inside without creating any friction. Then there's a heart muscle, which is known as a myocardium. And then there's an inner lining, which prevents the blood from clotting in the heart, which is known as endocardium. So all the 3 layers of the heart can be affected by the coronavirus. So a picture of pericarditis, myocarditis, and endocarditis, or combination of all 3 can be there. And sometimes the ECG is indistinguishable from that of an heart attack. You do an echo and you find that the ejection fraction is reduced, but there's no regional mole motion abnormality of suggesting of one particular place. The enzymes, what we do, cardiac enzymes which are liberated are way up in the skies. And when you do CT chest, it might show some ground glass appearances. You do a RT-PCR, you will find that, yes, this is positive. So you will have to then use your clinical judgment whether this is a heart attack in which there is incidentally coronavirus infection, or whether it's the coronavirus infection which has produced all these cardiac problems. Sometimes it becomes a little difficult to prove.
Excellent.
Conservative management is the treatment of choice at this stage.
Great, Doc. So Mr. Harbans Lal Grover from Delhi asks, on a cold January 2019 evening in Delhi, I suddenly perspired. I was okay in 5 minutes. I was at Lori Junction in Open. Nothing after that till today. Age 63 years, no diabetes, no BP. Any reason to worry?
Yes, it is absolutely important to go to your doctor. Let him do your ECG and a stress test and 2D echo. If they are clear, then 85% chance that you are not likely to suffer from heart disease in the recent future. But if there is something, it is better to check and see what is wrong. Let your doctor decide. You don't try to become doctors yourself.
Awesome. Thank you. Doc, on a separate note, does exercising with a mask increase the probability of a heart malfunction?
Yes. See, I was in the theater in Car Induja day before yesterday. Actually, on Friday morning, I was talking to the anesthetist. She says that wearing a mask, they have a ventilator in which they find out how much carbon dioxide, EtCO2 is collected. And she says, surely there is some collection of carbon dioxide. Now, people who are prone to heart attack, they are likely to suffer from a problem. So they recommend that when you are exercising, you don't have to wear a mask. Keep 6 feet distance from everybody else and exercise. Also, go for your morning walk. Don't wear what is known as N95 masks because they are thicker masks. You wear an ordinary surgical mask. If there is nobody in the vicinity, you can put it below your nose, not on your neck, just a little bit so they can breathe comfortably. And if somebody comes in, either you cross the road and go on the opposite side, which we do normally, or wear your mask and then pass that person and again keep on walking with the mask just below your nose. One more note, there are masks that you see with valves, by the side. I think the government tomorrow should ban all those masks. Why, you will ask me? Because when you are breathing in, you are breathing through the N95 mask. When you're breathing out, your air is not being filtered. It is coming out through this valve in a jet form, and it will infect anybody and everybody around you in the house and in the clinic and in the market. So N95 masks with valves should be banned, according to me.
Great. Doctor, again on the medication, a couple of questions that have come up. Do statins cause organ damage? What are the side effects of statins? And does this medication need to be taken permanently? Is it so that through a good diet and exercise, the person can stop taking those medicines?
Good question. Anything under the sun, including the sun with the heat stroke, can kill you. Aren't you going to go out in the sun? Don't you want vitamin D? Don't you want to be healthy? Yes. If your cholesterol levels are high, LDL, after a diet control, exercise, everything is above 100, it is better to take a small dose of medicine and bring it down below 100. Now, those who have had heart attacks or angina or heart problems, their LDL cholesterol should be maintained below 50. For quite some time, we like to give a good dose of statin so that you bring it down to 50. Why? Because there are unstable plaques somewhere else where you had heart trouble or heart attack. And if they rupture, as I told you some time back, you can get a massive heart attack. So these statins stabilize the plaque. They have lots and lots of pleiotropic effects which are beyond the range of this conversation. But they do tremendous good. However, some people get muscle pains. You do muscle enzymes, CPK, and show that it is normal. So the muscle pain is in the mind because he has read about it on the Google and not in the body. However, if it is elevated, then you reduce the dose, change the statin, use ezetimibe, use other medications that don't produce that muscle damage. Also, liver can be damaged. Now, what happens is we do SGOT, SGPT with the liver enzymes. Up to 100, 36 to 40 being normal is totally permitted. Above 100, we don't like because then you're likely to damage your liver. Some people may find that, no, I have got a little diabetes. Yes, those who are diabetics, their blood sugar may be affected, but you should adjust the dose of the anti-diabetics rather than thinking of reducing the dose of statins. Okay, select a statin which is less effective on the diabetic part or blood sugar part rather than go to a doctor, he'll advise you. Also, kidney damage. Yes, they can damage kidneys also, but the damage that is caused by it is so minimal that I think they are being exaggerated unnecessarily.
Understood. Thank you so much, doctor. So, let's say someone's going through a procedure or a surgery and he's on blood thinners, a dental surgery for that matter.
Correct.
What do you do?
Okay, now if you have got a stent put inside your heart. Now, these stents are notorious that there can be clotting of blood in the stent, and you get stent thrombosis, which is 40% mortality. So, you cannot take chances. Current stents that we have, within 3, maybe maximum 6 months, you can reduce the dose of your antiplatelet agents. You can take only 50 milligrams of aspirin and have your procedures, surgeries, dental procedures. Dental procedures are being exaggerated for nothing at all. A dentist can put a gel foam in the mouth, put a gauze piece, and press on that, or he can take a 2-3 sutures from where the tooth is removed. And I don't think there's any problem in the dentist. But the main problem really comes in brain surgery. If somebody needs a brain surgery where you cannot control the bleeding, or the bleeding occurs is going to push the brain structures, then we should stop and take a risk. Otherwise, all other surgeries, we recommend that 50 milligrams of small dose of aspirin should be taken, unless, of course, long time has passed and things are absolutely all right. But I would prefer still that 50 milligrams are taken those who have got stents in their heart.
Okay. Thank you, doctor. Now, let's look at the recovery bit, doc. Does life ever get back to normal after going through an episode of a heart attack? What is the level of physical activity that one can pursue? Imagine that guy who passed away, who was a marathon runner. Had he been saved, could he have actually gone back to running marathons?
Yes, Kunal, that's a very good question. Now, when I was a student, many years back, people who had heart attack were made to lie down 6 weeks in bed. They were not supposed to get up to even pass stools. And they were completely deconditioned. Today, if somebody has a heart attack, we ask them if their blood pressure is stable, if there are no irregular heartbeat, next day to sit down on the bedside commode chair and be comfortable. Can you imagine passing stools against gravity on a bedpan? That is more strenuous than sitting down on the stool. Bedside commode. So we allow them that. And gradually we mobilize people, taking into consideration the heart rate and the blood pressure. As you move immediately after, say, 4-5 days after your heart attack, if the blood pressure goes up and pulse rate goes up, that means the pumping of your heart is good and it is very nice. However, if your blood pressure falls and your pulse rate goes up, you need some more rest. If the ejection fraction is normal, you will be able to go back to all the activities and business and everything that you did before your heart attack. If the ejection fraction drops drastically, 66% to 50% is the normal ejection fraction, then you may have to curtail certain strenuous activities. Otherwise, majority of the people should be able to go back to their own job and do it more vigorously now that you have a heart attack and you're on medication, then you're safer.
Super. Thank you, Doc. Another audience question. Do you recommend LP into brackets A? I don't know what that stands for.
Yes, I will tell you what it is. I am all for it. Yeah. You see, this is a lipoprotein little a. I have been shouting from rooftops for the last 35 years in all my seminars. Please control your LPA. No, there isn't sufficient evidence. The other cardiologists tell you. This is not, it is only a marker. If we have seen families in which LPA is elevated and they get a lot of heart attacks. Simple medicine, nicotinic acid, lowers this LPA. Unfortunately, it is not related to exercise, not related to diet, not related to smoking, not related to any other risk factors that you know of. And it's a marker, yes, but if you control it, what is wrong? You use nicotinic acid, okay, your blood sugar might go up, control it with the medicines. I have had a Christian patient who came to me. He was seen by somebody, and angioplasty was done long time back. This must be about when the angioplasty started, maybe 20-25 years back at Hinduja at Mahim. He had heart trouble, so one stent was put. Then I was at Harkishandas Hospital. He was working for Air India. He came to me. We did his angioplasty in another vessel. That vessel was okay. Then when I was abroad on a conference, he went to Holy Family Hospital. Third stent was put. Then I started scratching my head. Why is he coming again and again? And it is LPA. His LPA was markedly elevated. We lowered his LPA. He went and retired, went to Goa, comes periodically for checkup. He's absolutely all right. No more heart trouble for him.
Great. Understood, doctor. Another audience question, which is, how do you differentiate between a fit and a heart attack? Is there a
See, it is
connection?
like this. I'll tell you. By fit, he means the convulsion. Okay, if the heart stops because there is less blood flow going to the brain, you can get a convulsion. That's known as Stokes-Adams syndrome. The word used is Stokes-Adams syndrome. But when the fit is over, you will not find any pulse or blood pressure. Whereas the person who's getting a fit, he has pulse and blood pressure and is breathing. He doesn't stop breathing.
Wow. Okay. Okay. Understood. Doctor, again, a simple basic question. How often should you go through a medical test? A normal, routine human being.
I would suggest that if you're 40 plus, or if you have strong family history of diabetes, blood pressure, and heart trouble, maybe even 30 plus, have a total body profile done, which will tell your cholesterol, etc. Have an ECG taken, and let your doctor decide if you need more tests or you don't need more tests. Once a year, you send your car for a service, right?
Yes.
Patients come to me, doctor, I came to you 5 years back. I had trouble, but now I'm absolutely all right. And I said, why did you not come in between? No. I was all right, so I didn't come. So I said, you are like a fellow who has a car. You send for service? Yes, regularly. I said, you're an idiot. You're spending money on the servicing of your car, which is worth a few lakhs of rupees or probably a crore rupees. And on your body, which is, you can't imagine how much it is worth. You're ignoring. You don't wait for the car to fail on the road and then look for a mechanic. This is what you're doing. By not coming to a doctor, you're waiting for your heart to fail or get a heart attack and then start looking for a mechanic to repair your heart.
True. Very true, doctor. Another audience question is, my father is 94 years, no disease, no heart attack, but he gets angina pain. Does a heart pain without a situation of an attack?
It is not, as I told you, angina is reversible. Heart attack is total blockage and irreversible. So when a person gets angina, he should be on anti-anginal drugs, taking care of the risk factors. There are lots of anti-anginal drugs available today to us, which can relieve the angina. And the last trial, the ischemia trial, has shown us that if your angina can be relieved by medications, unless you have left main coronary artery disease, you needn't really go for angioplasties and bypasses, because with good medical therapy, what is known as OMT, optimum medical therapy, you can control a lot of people. And despite optimum medical therapy, they still continue to chest pain, then proceed further with the procedures.
Understood. Thank you, Doc. I just want to take a step back to slide 2, where we discussed about medication. The
Right.
medication that you take, let's say in an emergency, does it have any side effects? If you take one dose, I mean, everyone should just keep a pouch like you keep with them all the time, right?
Yes.
Are there any side effects of taking that medication once or twice till you go to the hospital?
I will tell you what. Every medicine, as I told you sometime back, has a side effect. Suppose the pain was muscular pain and you took this medicine. Will it do any harm? No. If it is acidity, your acidity may increase a bit because you're taking aspirin. Otherwise, these are harmless medicines. They are not going to do any harm. Glycerol trinitrate may drop your blood pressure, you may fall down. So as I told you, sit down or lie down and then keep under the tongue. So you take all the precautions and then take the medicines. If there is no heart attack, nothing happens to you. I mean, there is no problem. If the esophageal spasm, sometimes when you eat food or something, there's a spasm of the esophagus, which is almost impossible to distinguish from heart attack. Keeping a glycerol trinitrate on the tongue may relieve esophageal, so you're comfortable, but you didn't have heart attack. There's no harm done.
Okay. The last question is a personal question, Doc. My granddad survived 3 heart attacks over 15 years. Why did the second and third heart attack happen? And what could we have done differently for him?
See, it is like this. As I told you, age is one thing that as it keeps on advancing, you are likely to get heart trouble. 2, family history. I don't know what was his family history, whether his brothers, his father, and all had coronary artery disease. 3, long time back, we didn't have very good medicines. And the patients, when you prescribe medicines for them, I don't know about your granddad, they refuse to take all the medicine. They'll take only half the medicine. Garam lage che. They have their own stupid ideas that this is not good for me. Doctor, I know my body. My body speaks to me. One Parsi chap, I did his angioplasty. He was diabetic. He says, my body speaks to me. I don't believe in taking anti-diabetics or taking this cholesterol medicine. He got a heart attack and he died after that. So if you feel that you are over smart and your body speaks to you, then body doesn't speak. It's a long time for the body to speak to you.
Sure. It's always good to take a practical perspective.
Yes, you go to a doctor you have faith in, and he will do justice for you. I can assure you that much, Kunal.
Absolutely. So, Doc, I think we've done with most of our questions. Thank you so much for your time. I'd like to hand it over to our beloved President-elect, Rotarian Sudhir Seth, for thanking you and everyone for helping us understand the heart attack war. Sudhir, over to you.
So I have a pleasant task of giving the word of thanks. So of course I will start with Dr. Surendra Soneji. Indeed, thanks to him for a detailed explanation of CPR and AED and how to use it. Now, Suren, as I call him, has been in the forefront of promoting life-saving techniques for over 30 years or more. I have known him for 60 years from school days. What comes out is his passion to educate the layperson to help the community. As he himself said, if I get a heart attack, then I can't help myself. It's got to be the others who are around me who must be aware of some of these techniques. To his deep knowledge of the subject, he adds great communication skills so that common people like us can understand. Because some of these matters are so technical that if he talks in doctor's language, then we would all be flummoxed. So I think Kunal has done a great job of eliciting, simple explanations, and Dr. Soneji has very kindly given detailed explanation in simple terms to us. He's greatly concerned about the welfare of the community. And because of this, he has himself gone around and got donors. And as he said, he's so far got 12 AED machines. He's got them at critical places like police stations, which are places which are commonly available and accessible to us. I know there's one in Juhu. I think there are two in Juhu now because people come for morning walks. And, these are the points where one could make maximum use of these. So he's himself personally come there in the mornings and trained people, and he's collected a lot of people around him. He trained them how to do it. He's made them personally do it in front of him so that they get a first-hand feel. He is now, I think, ever looking for more and more people to give.
One hour is over, I think.
Sudhir?
Vinith, please prolong for 2-3 minutes.
No, I think Sudhir's network probably is an issue.
Sure. Yeah, because...
All right. So I'll take over. I just wanted to thank all of y'all for participating in this important discussion. Sorry, Sudhir, you're on. Please go ahead.
Yeah. So, the people there had an AED machine in a glass cabinet. And so, of course, we got interested. We said, oh, you have AED machine. You know how to use it? They said, no one has told us how to use it. It's there. So a lot of places, we don't want to have AED machines where people don't know how to use it. And he is in the forefront of all this. And I think he's doing a great service to us as our club member and to community at large. And with this particular seminar having gone virtual, he has been able to even address people outside. People, I think some overseas people have also tuned into this program. And then as Kishore said in the beginning, we've got quite a few clubs co-hosting this. So we are very thankful to them also for having tuned in to listen to Dr. Soneji's very elaborate and very interesting topic of discussion for all of us. So we profusely thank Dr. Soneji for this opportunity. And I would also like to take the opportunity of thanking Mr. Anil Chugani from I think it's called
City Camp,
yeah, who are distributors for Philips. And he's been helping. He's got the 2 videos you saw were taken by him. So he has also helped in promoting this activity. So thank you very much for everybody for having joined this program. And thank you, Dr. Soneji, once again.
Thank you so much, everyone. See you around. Bye-bye.
bye.